Hey, it's Scott. And we're here in Orlando at the International Medical Simulation Conference. And I wanted to quickly go ahead and play with, honestly, one of the neater toys that I've seen, and that involves going ahead and practicing doing blood gases. So when it comes to doing a gas, otherwise known as an arterial blood gas, especially in children, we don't do them happily nearly as often as we used to. But if you've got a little kid who's sick as a dog and you really need to know what's going on, they absolutely still are getting done. The problem is they hurt. And as you can imagine, getting it done as easily as possible is certainly where it's at. So a couple things come into play. First of which, before you stick, remember many places will still teach you to some variation of something called an Allen's test. And an Allen's test means if you take a look at your arm, remember there's predominantly two arteries that feed the hand. On the side of the ulna is something imaginally known as the ulnar artery. And on the side of the radius is something imaginatively known as your radial artery. And that's important because if you're going to stick something into one artery and potentially going to have an issue, you like to make sure that the other one is hopefully still feeding your hand. So when you do an Allen's test, the whole idea is this artery feeds part of the hand, this artery feeds part of the hand. And in our case, if you do an Allen's test, that's whereas you squish both. And you squish both, and you see here how the hand is lit up. The idea being that not a whole lot of blood is going past where I decided to squish. However, if you're going to play with an Allen's test, what you do is first, you take your finger off one side. And then we started off, but now a couple of seconds later, you see that the hand returns to normal. Or in our case, now where we're squeezing both, if I take my finger off the other side, you can see that within a couple seconds, we happily get blood flow down here as well. And that really is a big deal. Before you stick something into here, you want to make sure that hopefully what's left over is going to allow you to still have a hand at the end of the day. So when it comes to doing a gas, option number one, and still very commonly used, is called we feel it and stick it. So in our case, whether it's with a regular needle or especially in kids with the butterfly, we can go ahead and find the radial artery, stick, and once I stick, we see how we've got blood immediately flying back in. And if I'm going to draw either for a blood gas or whatever it might be, we can go ahead and just immediately do what we need to do. So if you're able to feel and easily stick, that's great. However, if you're sick as a dog, actually feeling where you want to stick is not that easy. So that's why more and more places have gone to ultrasounds. And with that, this idea with the trainer, the same idea applies. Whereas you can go ahead and take your probe and on the screen see exactly where you want to go ahead and stick, i.e. that nice whole dark circle. And in real time, while you're staring at it, you can go ahead and stick the vessel as well. So the moral of the story, the days of just sticking are still there. But especially with the advent of number one, ultrasound, and number two, the fact that now we have toys that you can actually practice with to make sticking somebody a whole lot easier is something you're probably going to play with a whole lot more in the future.